countries to improve their civil and vital registration systems. These tools are mainly not the e-tools, but everything is paper-based tools, but that provides the guidance for countries to base their e-systems on. And later on, Anneke will join and she will speak about the use of these tools in countries, the experience we have had over the last 2 years. And then she will also go on to talk about few of the new e-tools available for countries to improve their civil and vital registration systems.
So Dr. Rasika, you are now the presenter. I hope you could share your desktop so we can see your slides.
Yes, I'm going to share my desktop now.
There, we could now see your desktop. Thank you very much.
Can you see my desktop?
Yes, very clearly.
Okay, thank you. So I'm going to start our presentation today. And I'll start by saying a few things about the Health Information System Knowledge Hub and the work we do at the moment in countries. Health Information Knowledge Hub is one of the hub initiatives established in 2008 by AeHIN. There are 4 hubs in Australia, and our hub, which is situated in University of Queensland in Brisbane, is the Health Information Systems Knowledge Hub. So what we do is we provide research evidence to inform policymakers throughout the Asia Pacific on need and use of health information for their system development. These hubs were established in response to the need for a strong health information systems to guide health programs, policy and to measure progress by countries. So this was an offset response to few of the country demands on health information system development by countries in Asia and Pacific. And in the Health Information Knowledge Hub, we work across many health information systems, including civil registration and vital statistics systems. And we have strong link with wide global network partners like World Health Organization, World Bank, Health Matrix Network, University of Washington, University of Melbourne, and there are other partners as well. Anneke's presence here and this year with us is part of the collaboration we are having at the moment with Australian Bureau of Statistics, and we are fortunate to have Anneke with us for 2 years. So what we do is we strive to produce and disseminate knowledge and information about the best systems and methods for improving health information systems to strengthen the health systems in countries. And we engage in research that will aid decision making for countries in mainly the Asia and Pacific region. And also we help the countries to build their own capacity in health information systems. So this picture is from one of the workshops I had last month in Fiji. It's a regional workshop for doctors on death certification training. So we do numerous workshops like that to help the countries to develop their own capacities to develop their health information systems, including the CRVS. So what is civil registration and vital statistics? I'm sure you know what it is because you have come here today for this seminar because you understand the importance, but I thought for the completeness sake that I'll go through a definition of civil and vital registration systems. Civil registration and vital statistics system generally include civil events like marriages and divorces, but birth and death and cause of death are the most important statistics that are collected under CRVS for public health policy. So we record, under these systems, we record fact of birth or death, the number of deaths and number of deaths, and then the causes of death. And also systems also collect, CRVS systems in countries also collect socio-demographic information on birth and death, including marriages. Well-performing civil registration and vital statistics system should be a continuous and complete reporting of vital event with medical certification of cause of death in a defined population. Although we say that we know that countries are at different levels of development, different level of completeness of birth and death registration, and also at different level of quality of producing medically certified causes of death data. And usually we expect that CRVS systems are implemented according to international guidelines prescribed by UN principles and recommendations and the WHO, World Health Organization, International Classification of Diseases. The importance, we expect that civil registration and vital statistics system data to be the foundation for most health information systems in countries, that they provide. Hello?
Dr. Rasika, you're still on board.
Okay, thank you. Yeah, we expect the country CRVS system data to be the foundation for most of the health information systems in countries, and under these systems we can develop further statistics on life expectancy, fertility and mortality patterns, and also it helps to calculate indicators of human health and the development and the national progress for achieving international goals like Millennium Development Goals. Therefore, we think that reliable statistics on birth and death and causes of death are therefore essential or good governance for sound policy making. Therefore, in all sense, they should be called as vital statistics. So we believe that it's called vital for a reason because it's vital for countries to have birth, death, and causes of death data for their policy making and resource allocation. So that was like a small introduction of what the Health Information System Knowledge Hub does, and also what we mean by CRVS and what their importance is. Now I'm going to take you through few tools that we use at the moment in countries for assessment and development of plans and the improvement of the CRVS systems in those countries. Although most of us understand the importance of CRVS, we also know that many countries' vital statistics are of poor quality or outdated or simply not available. So therefore, the use of these statistics is limited for policymakers because of the incompleteness and unreliability of the information produced by the countries. Therefore, the countries urgently require guidance about best practice methods and strategies that are feasible to implement to rapidly strengthen CRVS systems. So at the Hub, we have developed a series of tools that countries can follow in sequence to help them to assess their CRVS systems and to improve their systems. At the moment, we are applying these tools across Asia and Pacific mainly, and also some of the Pacific countries in collaboration with the international partner agencies, including Health Matrix Network, the World Health Organization, and UNSCAP. So this is where we start. We start with a rapid assessment, which is a small rapid tool which has 25 questions in all, but these 25 questions covers all areas of the CRVS system. This tool is small and it will take only 2 to 3 hours for country to go through this assessment, and we expect that, and we have found that in many countries, once they have done this assessment, the country stakeholders get a reasonable good feel about where their systems are at the moment. Because most of the time we assume that the systems are functioning, but nobody has ever done any assessment to determine how well the systems are functioning. So this is kind of a primer for countries to go and do the comprehensive assessment. So we have done this assessment at the moment in about 17 Pacific countries and 27 Asian countries. I don't have statistics from Africa, but these are the countries that we have done in Asia and Pacific region. Comprehensive assessment is like more comprehensive and lengthy exercise, and these tools are available on the Health Information Systems Knowledge Hub for anybody to download and use. And at the moment, around 12 Pacific countries and 6 Asian countries have done their assessment using our tools. And for all these assessments, we have provided the technical guidance. So once you have done the assessment, countries know the gaps between the gold standard and the country situation. And then we have developed this strategic planning tool to help the countries to develop a strategic plan and to prioritize their development plan. So this is the third tool, but that's the link between the implementation and the assessment. This is also available on the Health Information Systems Knowledge Hub website. This is a guidance tool that we develop in response to country need of, because most of the countries have poor quality data, cause of death data with high proportion of ill-defined deaths. We developed this tool in 2010, and at the moment we have trained nearly 300 medical doctors in Asia and Pacific region how to certify deaths correctly using this handbook. This is also available from the website. Also, countries can request for printed copies through our website. This is a resource kit. This is a big document. It's really a resource kit on how countries can strengthen their CRVS systems. This has 8 modules on each component of the CRVS system, starting from legal framework, to the registration process, then the cause of the statistics, coding, advocacy. So it covers everything, and the interim measures, verbal autopsy. So this covers and gives you guidance. Countries, once they know the gaps from the assessment, the countries can refer to the relevant section in the resource kit, so that it will give you the gold standard practices and also the resources available for countries to use improve their civil registration and vital statistics system. Resource kit is at the moment in the pre-press version. So we are expecting by the end of this year this will be available as hard copies and as soft copies from both websites of the Health Information Systems Knowledge Hub and also the World Health Organization website. So that brings me to the end of the tools that we use at the moment, the hard copy, the guidance tools we use to improve the civil registration system. And now I'll hand over the microphone to Anneke to talk about why CRVS is important for countries, and she will describe why some of the work we have been doing in countries.
For the meantime, will unmute Rasika. Are you still there?
Yeah, I'm there.
Yeah. Okay. I will unmute Mark Landry. He would be asking something. Mark?
Yes, thank you, Leah. I was just hoping that Rasika could pause here and maybe take any questions regarding the tools before we move on.
Thanks, Mark. Yeah, I'm happy to take any question if anybody has any questions on these tools. And more exciting tools, Anneke will talk about later about the e-tools, but these are the basic tools that country needs guidance to use those new tools. Is there any questions? Anybody wants to ask me any questions on the tools that I have presented until now?
So far, we don't have any lineup question, but Dr. Rasika, I have a question for you. I note that in the last AeHIN workshop launch in Bangkok, we learned from Indonesia that they are prioritizing on creating training modules on CRVS. Can you share on steps that you could recommend to Indonesia on improving their current capacity building activities or initiatives on CRVS?
Thanks. I think the country has, I can't give one formula for improvement, but I know Indonesia has already done the comprehensive assessment, so the plan or guidance should come from the gaps you identify in that assessment. So if I know the findings, then I can give them more tailor-made plans to them, because we can't really recommend one plan for all countries. And this resource kit document should have all the guidance. And in general, I can say that they have to improve their legal system, the legal background for doing the CRVS, and I think they also need to strengthen, because it's a problem in all countries that the certification by doctors, they improve the cost of death certification. And also maybe if they have a lot of home deaths, there's a place that they should try, consider using verbal autopsy as a method to capture the causes of death for the deaths that occur outside hospitals.
Thank you very much. Any other follow-up questions? Maybe we could ask Annie from Indonesia. Anyway, maybe we could move on. If you have questions, you can use the chat box, or you can raise your hand so we could unmute you and you can voice out your questions. Okay, so maybe we could proceed to Anneke. Thank you very much, Dr. Rasika.
Thank you.
Okay.
Hi everybody, my name is Anneke Schmider. I'm a director at the Australian Bureau of Statistics, and as Rasika said before, I'm currently working with the University of Queensland and other partners like Mark to look at civil registration and vital statistics in the Asia and Pacific region. This part of the presentation is just a little bit about what we've learned this year, particularly in countries, about why civil registration and vital statistics is important to them. I thought that I'd start off with my own country, which is the one that I know best. I've just come from a position where broadly I look after the statistical elements of the civil registration and vital statistics system in Australia. We work very strongly with our registries and also with our health agencies to make sure that our civil registration and vital statistics is as strong as it can be, but that's not to say that we are not without challenges in our civil registration, much like just about every other country we've been to. So just to start, civil registration is very important for all countries, and particularly in Australia, but also most of the others that we've been to. It forms the basis for legal identification in most countries. It's essential information for health, social and economic planning, and I'll show you an example of what it does in that respect in just a minute. And it's also very important for research purposes, particularly health research, with the mortality information that it provides, but also the fertility information that it also provides. So in sum, it provides many, many benefits to a country when it's functioning well. And this is an example of civil registration and its benefits in Australia. At the base of the tree, civil registration through birth and death registrations provides the basis of what becomes a very broad and influential system. Individuals have identity confirmation from this process. If you look to the left of the tree, they also become eligible for social payments in Australia when they receive a birth certificate. On the right-hand side of the tree, there's legal use from birth and death information, including identity confirmation for legal purposes, citizenships and passports. And also in Australia, there's a very large conversation about birth and death information being used for preventing fraud, and particularly identity fraud. As we move further up the tree, you'll notice in the centre I've got the Australian Bureau of Statistics. We actually code the causes of death and collect the births and deaths information for nationally from 8 state and territory registries. Once we process the data, it's used for a really wide variety of purposes in Australia. To the left side of the tree, there's the social purposes. Of course, one of the issues in Australia is an ageing population, and planning for that ageing population and birth and death information is really important to that. Education and community planning. If we don't know how many children are being born, then how do we plan our education system and where it needs to go, particularly in such a large country in size. And of course, child and parental programs are all based around birth information, infant, child and maternal mortality information as well. Moving on to health, obviously there's causes of death, general mortality and fertility information, but also we do a lot of work with our causes of death data and specialist health topics like cancer, diabetes, suicide deaths, and one that I've been particularly involved in has been Indigenous health and mortality in Australia, and our Indigenous Australians have quite different health and mortality profiles to non-Indigenous Australians, so this is an important area of work for us. Moving around the tree, this is the essential underpinning of civil registration in Australia. It's used to underpin our financial transfer system between governments because it provides population information in between our census. So we can produce birth and death information on a quarterly basis, and this is used for states to work out how much money they're owed by the Commonwealth, or the Commonwealth to work out the share of money to be spent in the states. So it's quite important, and that feeds into our economic program as well. So understanding population growth and change, again the ageing population and the economic impact of that, and in a very large island continent like ours, sub-regional growth and impact. So I hope from that particular slide you'll see that there are a really wide range of benefits that a country can have from a functioning civil registration and vital statistics system. Hence the reason in Rasika's presentation there's so much emphasis on understanding, studying and assessing gaps and weaknesses in civil registration, so that the basis can be good enough to provide a country with what is quite critical information. We've been to a few other countries this year as well, and I thought I'd share some of the information from those. And Mark's also been to some of these, so he might like to chime in with some points of interest. Earlier in the year we went to Mongolia, who've done quite a lot of work, particularly around assessment with their health system, and they're extending this to civil registration and vital statistics. Similar to what I know in Australia, they use this information for health purposes, but also for their population counts in the country. So that dual purpose is very important. But of course, in such a large country and the least densely populated country on earth, they've got some geographic collection issues, they've got remoteness issues. These are challenges to any health information system. They've got a nomadic population. They've got very high rates of hepatitis B and C, which is important when you're considering the causes of death. And when we went there, we discovered that there were some issues with the coding in the system. So the real health, or the real underlying health issues were not really totally reflected in the data. And just to illustrate why it's important to understand the functioning of your of your civil registration system. When you have weaknesses in your system, then you don't end up with good information. And in the case of Mongolia, what we found was that the coding of their data was resulting in very unusual cancer distributions, and particularly high predominance of liver, stomach and lung cancers for males, and liver and cervix and stomach cancers for females, which is an unusual cancer pattern. And this is generated from the fact that the coding is not being undertaken properly. So it's important as part of the assessment that they're looking at how well the classification is being applied to their data and what that means in terms of their results. Turning to Cambodia, earlier in the year, they have quite a differential civil registration and vital statistics systems here that had a lot of focus on birth registration in the country, where we found that most births are probably registered, however less than 10% of their deaths are registered. One of the issues for this particular country is that most births and deaths occur outside the hospital, so there's no guarantee of any hospital information on a birth or a death, and probably little chance of death certification. And given the information that's not available, there's often erroneous reporting. For example, we found some evidence that because of particular focus on data capture, HIV and AIDS was classed as the leading cause of death in Cambodia, when in fact really what it is the leading known cause of death, with the rest of the mortality profile unknown. So consequently, there's a lot of focus on capture of information on diseases like AIDS and TB and malaria, because the data is collected separately. And what this means for the country is that its health information on mortality is quite poor. You can see from this pie chart that they class other causes of death as more than 50% of their mortality profile. The classification being used here is not the ICD-10 classification, so in fact it's very difficult in Cambodia to understand what the population is actually dying from, and particularly comparing that to regional or global or other country mortality profiles. So for Cambodia, it's a case of comprehensively assessing their civil registration and vital statistics system, and the two areas of very strong interest in Cambodia will be improving the registration and medical certification of death and improving the coding of causes of death. We've also been to the Maldives this year, and then the Maldives is quite a different story. Obviously very different geography in the Maldives, but they've got very strong reporting of their births and their deaths in their system, and particularly with deaths, the Islamic tradition of burial within 24 hours means that most deaths appear to be registered. The issue for the Maldives is that many of their doctors are from other countries, are not familiar with medical certification of death, and so death certification is very poor. And so this is another country that struggles to understand what its mortality profile is and what its people are dying from. More than 50% of the ICD codes in this country are ill-defined or other. And we were given examples of the medical certification where the cause of death was just defined as death. And of course this shows up in their mortality statistics quite strongly. You'll notice in this slide that the top 10 diseases are really dominated by ill-defined or other diseases, which means that the quality of certification and the coding that can be applied to that is not providing this country with very good information about its profile. I went to the Philippines earlier in the year. The Philippines used the comprehensive assessment process some years ago, and have been working on actions based on that comprehensive assessment over the last couple of years. Of course, the Philippines has collection challenges as well, like most other countries, including a dispersed geography and quite a significant population size. The thing that I noticed in the Philippines is that there's really a lot of significant technology initiatives within the country. They've harnessed a WHO system of SMS reporting for disasters, and they're trialling that at the moment as an SMS reporting for maternal deaths, which are a known issue of concern for the country. They also have a mobile registration within the country and a national registration week, I think it is, not a day. I'm sure there's a day that's devoted to it, but I think the national registration activities occur over a week. The Statistics Office in the Philippines is very strongly involved in the civil registration system, and at the moment they're rolling out standardised reporting system across the 1,600 administrative offices within the Philippines. And one of the strengths, I think, for this country is that they're looking at strategic planning for their civil registration and vital statistics across a 10-year time span. For this country, which has done comprehensive assessment, I think that the lesson here is that they've learnt the value of the strong coordination that comes from a comprehensive assessment, and they've managed to take that forward. Just moving on from the Philippines and looking at the technology parts, I thought I'd move into a little bit about civil registration technology and innovation, but is there a question?
I think we have a question from Raman. Raman,
Sure.
You are now on board. You can ask your question. Hello?
Hello?
Maybe his audio is not working. But for the meantime, I will ask one question from Indonesia, from Anneke.
Okay.
And her question is, what is the first step to strengthen CRVS when Indonesia don't have the same identity for each person's record from health centers or health cares? Again, what is the first step to strengthen CRVS when Indonesia don't have the same identity for each person's record from health cares? Because you said Indonesia is just in its progress in getting citizen registry.
Yeah. I think there's a number of countries that I know of that may have this same issue. The comprehensive assessment guide goes through a staged approach, or an approach which reviews what the legislation provides for compulsory registration and what the registration practice is. And these are probably the two areas that are most affected, or would be the two areas in a comprehensive assessment where you would pay most attention to how to bring together a common identity, or how to make sure that the various systems that are providing identity are coming together in an area.
Okay, so thank you very much for addressing that question. Dr. Ryan Banyas from Philippines has a question. Dr. Ryan?
Hi, good afternoon. Actually, one of the students from the UP College of Medicine has a question. So could you please introduce your name and then ask the question?
Okay. I'm Ronan Katanghal from UP Med here in Manila. So my question is, how accessible is CRVS to reach the people from remote areas like in the mountains or in remote islands?
When I was in the Philippines, we had a very large discussion about that, and it's a particular challenge for the Philippines, but also for other countries as well. The Philippines has a mobile registration program, which I understand they use to target registrations in the more remote areas and the mountainous areas. And I think that's the main reliance at the moment, as well as the fact that the Philippines has, I think, 1,600 administrative offices where they can collect birth and death registrations. But I know when visiting the Philippines, they paid particular attention to what they could do to try and improve birth and death registrations in those remote areas. And I think that's really quite critical. The Philippines has got a very strong coordination with its Ministry of Health and the Statistical Office and the local government offices, and they're quite vigilant about trying to improve the registrations in those areas. So thank you for that question.
If I can add few country examples.
Okay.
Yeah. That problem is like it's not just in Indonesia, a lot of countries, especially the Pacific region countries where we work, there are a lot of small islands. So everybody is aware of this problem, so it's not that a problem that's unique to Indonesia. And some countries are at the moment trying to use SMS messages as a way of sending those messages at least of births, to make sure that all births are registered. So there are a lot of innovative things going on in some of the Pacific countries, and also in Tanzania, in Africa. There's a good system in Tanzania where they use mobile phones, not the smartphones, just like the very cheap phones, to generate a SMS for all births to the national registration system, so that they capture all births. Thank you. Over to Anneke again.
Okay. So we will move on to our discussion. Go ahead.
Thank you. So I'll just move on to civil registration and vital statistics, technology and innovation. Some of these slides are from Mark, so Mark I'd like to talk to some of them, but some of these are based also on the experiences in Australia that I know about. So civil registration and vital statistics, I think I showed before, is a really important underpinning to modern governments. And technology now obviously is becoming more and more important in this system. And so the link between the technology and improving civil registration and vital statistics, I think, is becoming stronger. The term innovation is often used solely to describe technological advance, but I prefer to think of innovation as in a more broad sense, which is about introducing something new or different. And in the case of civil registration and what Rasika talked about before with assessing civil registration, it certainly is about innovating, about changing, about introducing new things or doing things differently. And in particular, as part of this assessment process, we look at business processes for registration and for data collection, and this is an important thing in relation to technology, because technology change or technology development should be very strongly linked to business processes. So just to recap that particular perspective of, and this is my perspective, I'm sure that other people have different perspectives, but with civil registration and vital statistics, it's very important to know the business process and how technology can benefit or sustain or develop that process in a better direction. So looking at the business process for civil registration and vital statistics, and I don't want to go into this in too much detail, but just to let you know that there is actually a business process for civil registration, which is broadly about collection, and this is of birth and death registrations and cause of death data. The processing of those, that might be, producing birth and death registration certificates. There's analysis, which is what you do once you get to looking at the data and any statistical output. And dissemination, which is about getting your information out there and being used. And then, of course, archiving, which we all know and love. And there's never enough archiving, in my view. But anyway, that's the broad business. Sorry?
Hello?
No.
Okay. So this is just the broad business process for civil registration and vital statistics. In my view, I did this yesterday. It's based on the statistical generic business model, but looking also at where technology can be applied at particular parts of that process. Quite often when we're talking about civil registration and vital statistics, the conversation will turn to automated coding, but automated coding is just a technology applied to a particular part of the business process. Likewise, registration software is something that's often spoken about when we're talking about civil registration and vital statistics, but again, it's just a technology that's applied at a part of the business process, and it almost never applies to the whole business process. So this is just to demonstrate that we need to understand at what point we're discussing technology improvements in the civil registration and vital statistics process. This is one of Mark's slides. I quite like this one because it shows that, you know, business planning should be happening before you're starting to develop and deploy information technology. And I suppose this is the key message that we're trying to talk about in relation to civil registration and vital statistics. Quite often the conversation jumps to the solution, but there's not the work put into analysis and design at the front end. Another one of Mark's diagrams. Thanks, Mark. This is looking at how business process requirements, you know, can be mapped to show how things interface or need to interface, how things should progress and in what sequential order, and also my particular favourite developing process descriptions and linking it back to that business process. These are taken from the Queensland Department of Justice and Attorney General, which houses the Civil Registry in Queensland, one of the Australian registrars. They've done a significant amount of work in the last 5 years in taking their registration process, particularly from a paper-based process to through a technology process, an improvement process. And so they've done quite a lot of thinking about their business. They've had to do a lot of work in developing their business processes, understanding what their business processes are and making them more efficient and effective, and then applying technology to parts of that process or to all of the processes they can. And they're still in a process of development, but they've done some very, very good work. And this is an example. At the moment, they're looking at introducing a birth notification system. This is to make sure that private hospitals in Queensland can provide information direct into the registry system, which obviously would be a significant efficiency improvement, but also makes a much more effective solution for making sure that all births have some sort of record. What they've done with this particular process is develop a set of business requirements first, and then develop their functional requirements from that and put those out to tender. So this is an example, I think, of good process in civil registration and vital statistics, understanding the business process needed first and then developing those requirements for the technology. This is another example that Mark provided the other day, which is about an open source system which is used in India, looking at registering birth and death online through the internet. And this is very similar to the directions that I know about in technology application in Australia as well, but increasingly these things are done through some sort of web-based system rather than developing software which and I'm not a technology expert, but rather than developing software and systems that reside in each agency separately, and then you have a lot of problems with data transfer, which is one of the characteristics of civil registration and vital statistics, that quite often the transfer of information can be held up by technology not talking to each other. And we had a laugh and a joke in the Pacific a little while ago that whilst you can have all these technology systems, an Excel spreadsheet is still the best way to send information from one agency to the other. So just some more examples of where technology is being applied to civil registration, both in an e-sense and in a mobile sense. And again, some examples of online birth registrations, text messaging and so on, which Rasika mentioned before. So the increasing use of mobile devices as well to record events or to at least capture an incident or an event, even if there's not the detail to it, I think is becoming much more popular in a technology application in some countries. And yet another example, this one again is from Mark, and he might be able to talk a little bit more about this at the end, but looking at the coverage and quality of the mortality system in Mozambique. And so some more detail from Ghana. And again, Mark might like to talk a little bit more. I think he knows a little bit more about these. I think the major point, though, from all of this is, notwithstanding the challenges, civil registration through the community, and particularly applying the technology, significantly improves birth registration. Thank you. Any questions?
There is one question from Indonesia again. Do they support research for developing CRVS technology in other countries? I think she's talking about innovation on tools and technology being used to actually capture vital statistics in every country.
Not that I'm aware of. I'm aware of a couple of open source type arrangements, obviously, that look at improving or developing technologies. And Mark might know a little bit more if Mark's still online, but I'm not aware of any research and development funding that's available for improving civil registration and vital statistics.
Thank you very much. Mark? Go ahead.
Yeah, just to add to that, I think this is precisely what we're trying to capture from this discussion, that clearly there's some demand, and now who could we discuss from the resource partner side and capture this interest? I think we're wanting to learn from some of the existing software packages that are available, like Vitalware, which is proprietary civil registration software, or learning about this BIRDS example from India and some of the mHealth applications that are being used. But I think it's time now to appropriately capture all of that and find out what we can learn that is good practice, and how to share some of the techniques for implementing innovation and using different ICT platforms for better civil registration and vital statistics system strengthening. So I would encourage anybody who's interested to inform the AeHIN Secretariat what is specifically you're looking for, and then we might be able to match that and discuss that with other countries or development partners. Over.
Thanks, Mark. I agree. I think the message from my perspective is the important one that you and I shared a few weeks ago when we discovered the Queensland Registry documents, and that's the importance of understanding both the business process and the technological options, let alone solutions that are available. And I think you're right, it's time for much better coordination on that particular front. Is there another question?
Hi. Hello. This is Dr. Ryan Banyes. I'm sorry I can't hear right now. I think something's wrong with my audio, or my internet. But my question is, how do we introduce the innovation of CRVS for those communities who are somehow resistant to the idea of having information being gathered by the government or by any other party? This is with regards to, I'm coming from the idea that there are indigenous communities in the Philippines who are sort of resistant to the idea of divulging certain information regarding birth or death. And the problem may lie in terms of not really capturing those people who might have information that can contribute to the national scope with regards to health statistics. Over.
That's a good question. I think many countries probably have that same issue. I think that the answer lies a few different ways. Firstly, having people at that level in the community understanding the importance of registering births and deaths and why it's important to themselves and to their community as well. So understanding that if you register a birth, then you can understand a little bit better what sort of education you might need in the future. The second part of it, I think, lies in, from my view and from a statistical view, is in bringing together different forms of information. So looking at whether you can collect various forms of information which might tell you in a less direct way, but still an informative way about what's going on in your community. So whether you can bring together some health information with your birth registration information to understand how many babies are being born in the community, for example, would be perhaps another way of looking at it. But I think that generally people don't understand the importance of civil registration to individuals or to the broader community. And that's probably an area where we need to do a little bit more work.
Yeah. If I can add something to it, that many countries have the same problem, especially the rural and remote and geographically dispersed population. Especially in Pacific Island countries, we know that there are a lot of people who doesn't want to register. But if you have some incentives attached to the registration, like some Cook Island, they have a baby bonus that they get some certain amount of money if you register the birth of the child. So that's something that especially those disadvantaged communities are looking for. If they get something out of it, they might register. Also, in some Pacific countries, they are getting like funeral payment, like some assistance with the funeral, because it's a time that families need some money. So if government is giving some money once the death is registered, the people are more tend to go and register the death. So we have seen some example like that in several of the developing countries, that they have used those methods in order to improve their birth or death registration systems.
Okay, thank you.
Okay. One question from National Telehealth Center. NPH would like to know more about how to conduct or devise technologies for mobile CRVS. Can you share your experience or things you found out on implementing mobile civil registration?
Can you repeat the question again? I really didn't capture the question well.
Okay. NPHC would like to learn more about mobile CRVS, or how to basically capture vital statistics using mobile technologies.
Yeah. I think there's and Mark will probably know a little bit about this as well, so I'll give a quick answer. Rasika's going to say something, and then we're going to flip to Mark. I think mobile registration actually applies at various points in the collection process for civil registration. It can apply at the point of birth. It can also apply, so you might capture a birth through mobile technology, and it would just be the event of birth. You might capture death through mobile technology as well, you might capture cause of death information through mobile technology. So there are a number of points at which mobile technology might become useful to you. But Rasika's got a little bit more practical experience on mobile cause of death information, which is interesting.
Thank you, Anneke. We are at the moment we have a study we are doing research in Tanzania in using these mobile phones, what they call dumb phone, the very cheap mobile phones, to register the fact of the number of births and deaths when they occur from the rural communities. As you know, the Tanzania is a big country where they don't have a national civil or vital registration system. So they're using this as a method or like innovation to improve their civil and vital registration system. For the causes of death, we are now coming up with a new innovative thing, very recently released. Like it's about 2 or 3 months old at the moment, that we use Android-based mobile devices, either mobile phone or mobile tablets, to capture the causes of death data through a process called verbal autopsy. These softwares are available free of charge. You have the, it's not a software, it's really like a small application which you can download from the web and train somebody like healthcare worker or some community health worker to ask some standard questions to arrive at the causes of death for the death that are not certified by a doctor. And also we are expecting within like 4 to 6 weeks time to have a software, again a free downloadable software from the web, to analyze the causes of death that you arrive like on the information you collect from those mobile devices. I have a small study in rural China, in 2 provinces in China, very rural, that they use mobile handheld devices, small mobile phones, to collect the causes of death data. And it seems we started this project in March 2012, like about 8-9 months into the project, and we have done the mid-evaluation, and we have found that the data collectors were really satisfied of using the phones to collect the data versus the paper they used to use. And also because you enter the data to the phone, that you get then you can email those questions back to a database, that you don't collect forms for a long time which nobody will enter into the computer to analyze. Once you have that data emailed into a database, then you can use the other software which will be soon available for public use to arrive at the cause of data from very rural communities where medical certification of causes of death is not available. We really started this project in China as a pilot, and it's one of the most successful projects that I have done so far. I'm quite happy that it's working. And we had a short course in registration and vital statistics last week here in Brisbane. About 20 countries participated, and we showed the technology to them, and most of the countries are happy to adopt that at least at small level, pilot level, to improve their death information. Mark?
Okay. Mark, go ahead.
I would just mention, clearly there's all of these examples and other opportunities for mHealth solutions for civil registration vital statistics. I wanted to mention that the Health Metrics Network has commissioned a research and analysis by the University of Oslo to look at and do all of the opportunities for innovation in mHealth for CRVS, and that report should be available sometime in December. So in the next 30 days will be a very strong business case for the use of ICT for civil registration vital statistics, and we'll certainly make sure that is made available.
And also when these tools are available for download, we'll let Mark know that he can make them available on the website.
Okay, so that ends our AeHIN hour. Mark, you still have something to add?
No.
Thank you very much for attending our AeHIN hour. Thank you very much, Dr. Rasika and Anneke. I hope you learned a lot from our AeHIN hour this afternoon. Hope we would be able to see next meeting again. This is Aliyah Evangelista. But before we go, I would like to invite every one of you to please answer this short evaluation form so we would be able to address all concerns and your evaluation on our AeHIN hour. So this is very important, so we could also send you more resources on this AeHIN hour. Are you on your chat box right now? So you could click that link and answer our evaluation form. Would it be okay if Dr. Rasika and would it be fine if we do a short photo-op session?
But I don't know whether my webcam is working today. We don't mind.
Okay. Anyway, we still...
It was there, but now I don't know whether it's happening or not.
Okay. Anyway, we still... if you have your webcam, you can open your webcam so we could have a short screenshot just to capture your virtual presence in our AeHIN hour. Hi, Annie. I saw Annie. How about the others? Okay, so we could take our short screenshot. I still have 2 of us who are on board. Are we still waiting for the others? Dr. Ryan? What? Hello? Hi, I see another participant, AeHIN. How about the rest? Maybe Dr. Ryan could open there.
Hello.
Hello? Okay, maybe we would... Hi, I would... Yes, this is fine. I will get a screenshot of everyone. Smile. 1, 2, 3. There we go. I hope I was able to capture that. Let me just check for a while. Hope you could bear for a while, so we just document it. Okay, thank you very much for attending our AeHIN hour. Don't forget to answer our short survey form. You can now leave our session. Thank you, Dr. Samantha from Sri Lanka, Dr. Ryan Banas from the Philippines, Roy Consulta from the Philippines, Ray Jimeniano from the Philippines, Rasika from all the speakers from the University of Queensland, Dr. Annie from Indonesia, and Dr. Sambat. Bye.